Distinguished delegates, ladies and gentlemen, to start the scientific program of the conference, I'm now proud to invite to the stage Professor Rosalia Sciortino Sumaryono, Chair of the International Scientific Committee, to deliver the keynote statement on the theme of the conference. Ladies and gentlemen, Professor Sciortino is a cultural anthropologist and development sociologist who has worked on sexual and reproductive health, gender, and international development in Southeast Asia for the last 30 years. She teaches at Mahidol University and Chulalongkorn University in Bangkok. She is also director of Sea Junction, a public venue in Southeast Asia. Previously, she was the regional director for East and Southeast Asia for the International Development Research Center, IDRC, senior advisor in health for Aussie in Indonesia, regional director for Asia for the Rockefeller Foundation in Bangkok, and program officer in gender and reproductive health for the Fourth Foundation in Indonesia and the Philippines. On the 25th November this year, she has awarded the medals of the Vietnam Academy of Social Sciences for her contribution to social sciences in Vietnam and the region. Please welcome Professor Dr. Rosalia Sciortino Sumaryono.
Sorry, one moment. So thank you for your patience. We are going to start in a few moments when everything is set. In the meantime, let me thank everybody who has contributed to this conference. As the chair of the International Steering Committee has been gender, political, and institutional equalities. The question is how to address it. We believe, as the conference organizer, that there is a need for a rethinking of actual policies and practices, which cannot just go on as usual if we are serious about addressing inequities. We believe we need to identify and address inequities in various sectors, and as you see, the conference has been organized around themes in terms of equity and justice in health, in education, in the justice system, and of course, cultural and social barriers that prevent the realization of inequity. And we need to put marginalized and disadvantaged people at the center stage. This resonates with a recent report of UNFPA, which clearly states that we are living in a world with different worlds that are very far one from the others. We are living in a time of inequity. And the focus, of course, is in this case on family planning and contraception and the lack of access of poorer women, or the reduced access of poorer women, and also their reduced health outcome, their greater exposure to illness and death, and all this also influence their opportunity in education, in employment, and a fulfilled life. So we are talking again about multiple forms of inequities that reinforce each other. Now, as the late Babatunde, we was, of course, as you all know, the Secretary and Undersecretary General and Executive Director of UNFPA until he died recently, as he stated very clearly, unless we start addressing the structural and multidimensional inequality within our society, we will not be able to have high-quality sexual and reproductive health for all. Now, the question in this context is then whether the SDGs can indeed deliver on their promise to leave nobody behind with the proposed approach of progressive realization, creating opportunity, win-win situation, everybody is fine, nobody lose out, and public-private partnership. In other words, can they indeed transform our world as they promise in their message? Again, the UNFPA report is saying that to stop the downward spiral of inequality, we require a vision, and I stress it here, of inclusive society and shared prosperity, grounded in principle of human rights and, of course, with the necessary human and financial resources. So I would say, examining the situation now in Southeast Asia, but you can, of course, generalize to other parts of the world, that there are at least 5 main challenges in the realization of such vision, which require a significant paradigmatic shift in the way we address sexual and reproductive health. Let me start from the first challenge: how to attain shared prosperity when we know that increasingly the world is becoming a more and more unequal place. Now, the first graphic is from a recent report of Oxfam, which stated that basically 1% of the population owns as much as 50% of the world population. Clearly something that is not just nor fair. We also know that in Asia-Pacific, we are talking about widening gaps for most of the countries. Although, indeed, many have increased their economic growth, that economic growth has not been shared equally among different groups in society. In the health system, we are well too aware that we are now confronted with a two-tier system. These photographs are from Indonesia, and we know that for the better off, there are now indeed many more options about what kind of care, targeted care, very expensive care. But for the poor, often the quality is not at the same level. And private investment tend to be in those places, of course, where there is major possibility of profit. So I am suggesting that even if we are uncomfortable, it's time to shift from a paradigm of creating opportunity, expanding access, to a paradigm that starts to address seriously issue of redistribution. Now that, of course, is not only very comfortable, may not be a win-win situation, but we know how to do it. There are issues of progressive taxes, there are issues of communication of health care, which can be revised. There are major emphasis on prevention and promotion and primary health care, and of course, universal coverage, if done indeed with no double standards. We also know that we can address some of the issues related to big pharma, which made the price of health services extremely addressed. Now, there is a tension here between public-private partnership and, of course, corporate interests, but I can sure we can think about that. Now, the second challenge, of course, is also when we talk about shared prosperity, how come that more than 50% of the population is still considered a vulnerable group among many other vulnerable groups? So the second challenge for us all is how to attain shared prosperity in the face of persistent patriarchy. We are not done with gender. This is my very clear message, because unfortunately, like also this conference reflects, there are less and less papers on women empowerment, gender equity in sexual and reproductive health. I am afraid that we are not over. The problems are still many. We are still confronted with entrenched economic, political, socio-cultural power imbalance, and that is reflected in the many problems that we are confronted today, which cannot be addressed unless we are serious about gender equity. Maternal mortality is something that clearly say if we do not go beyond technical intervention, we will not be able to address maternal mortality, nor all these problems. And here is what I am proposing, is indeed a shift from a technical to an empowering approach. I am not saying, of course, to do away with the technical. That would be foolish. But the technical cannot go alone. And the SDG recognize very well that, again, appropriate care is status, the status of women is linked to issue of public policy related to gender equity. So the empowering approach, of course, is down with patriarchy. We have not using this word anymore, but I think it's time to start to use them again, because indeed it's much more difficult to change gender roles in the family than it is to change in the public sphere. So we really cannot delink the public sphere from the private sphere. We need to discuss family role. The issue of men as head of the household is reflected in family planning program that don't allow women to access contraceptive if the husband is not signed. So this is the values that are beyond those kind of policy. We need to address them, and we need to recognize that women are not only reproductive agents, they are also sexual agents, including single women, which up to now are excluded from many sexual and reproductive health programs. So it is time, and here I can, of course, I am an old lady, so I am from the time of feminism, and I propose to bring it back. It's time to bring back feminism. It's time to challenge patriarchal power. Women should not be seen as just another vulnerable group. We are really talking about the majority of the people. Gender mainstreaming and men involvement, I am all for, and here there is also men in the picture, but only if they are willing to be transformative and support women in their choice, not to continue to play their protective role. Action on sex disaggregated data, we have said for ages. Again, this is something as an old person, I remember. Since 30 years, we have been talking about the importance of sex segregated data, but still we do not have them. The issue, for instance, of the Rohingya refugees, our majority are women and children, but still we don't know how many women, because the form is given to them is again according to household with the man as the head of the family. So we really need to do an effort of action, no more of talking on this. And most importantly, work to transform socio-cultural value. And here comes the third challenge: how to attain inclusive society amidst the rise of fundamentalist movements and politicization of religion. Now, these are just two photos of Indonesia and Myanmar. You could have many more from other countries, because unfortunately all over the world we are seeing a rise of fundamentalism and of politicization of religion, of all religion, whether Christian, Buddhist, or Islam. We know that fundamentalist movement, radicalized movement impact on multiple rights: the right of women, the right of sexual reproductive health, the right of LGBTs, the right of ethnic and religious minority group, of disabled people, etc. Minority groups are not doing well when we are talking with a fundamentalist perspective. So, again, we need to shift from being silent to being vocal. We need to take a stand. I don't think we can afford anymore to just stay silent and hope that it will pass, because this has proven that the space we have given has been taken very strategically by this group. We need to advocate for inclusive diversity, and I mean here not a sectarian diversity in which LGBT only strive for LGBT rights and minority groups only strive for minority rights, etc. We need to work together. We need to work, build cross-sectoral alliance, and I was very encouraged yesterday in Hong Kong. These are migrants workers who had the demonstration for both migrants' rights and LGBT rights at the same time, because they acknowledge the commonality of the discrimination they experience. Unless we build this cross-sectoral alliance, we will not be able to address the issue of fundamentalism and other conservative movements. Now, of course, all this is centered on the rights, on the perspective of rights recognized also in the SDGs. But how to realize a right-based approach in a phase in which we see authoritarianism come up all over the region, not only the region, unfortunately, we are talking about an age of backlash, an age of conservatism from the United States to the other part of the world. We see the failure of democratic institutions to deal with this, weak governance, and of course, very important to us, a shrinking space for civil society. Unfortunately, in this region, we are seeing very serious expression of disregard of human rights, whether the LGBT community in Indonesia, but also the extrajudiciary killing in the Philippines of drug users. These are not going to help us in fostering a sexual and reproductive health agenda, but more importantly, is against women's dignity. So we need, again, to think beyond development. We need to think in political terms. Unfortunately, again, may not be very comfortable for some of us, but if we are talking about regaining public space, we are talking about establishing new mechanisms, alternative mechanisms of participation and accountability. One of the issues with the SDGs is not clear who is accountable to what and what is the role of civil society in bringing government and private sector and other sector to accountability, and themselves included. We do not have good mechanisms to really bring and foster such a democratic agenda. Now, the last and final challenge, of course, we have the vision, we know what to do, may not be easy to do, but we do know what to do. So now the question is, who is going to pay for realizing this vision? And this is, of course, always a problem for civil society and other groups. Unfortunately, we see a lot of discussion about how to get new funding. This is also stated in the SDG, but not much discussion about how is this funding really used, who is getting money, and who is benefiting from this money. We see a growing influence of philanthropic actors. Now, I am quite happy about this. I have worked for foundation most of my life. At the same time, there is a risk when one foundation is contributing more than 50% of the resources to the World Health Organization, which is supposed to be a country-based organization. Governments are supposed to be in charge. So what are these going to imply? We are seeing on the other side declining international aid, so declining aid from country and more aid from private sector, whether it's business or it's foundations. Now, what are the implications of all this for us in the field? And of course, we know about the gag rule of President Trump and all the many implications that rule has about funding in reproductive health. So, in short, we could say all this is having a negative impact on sexual and reproductive health. Clearly, we don't see support for a comprehensive sexual and reproductive health agenda as promised by Cairo, as supported again by Beijing, as also clearly mentioned in CEDAW. Many of the CEDAW agreements should be reread because there is actually a lot there about what is a gender agenda, what is sexual and reproductive health agenda. Again, we know, but de facto, what is being funding again is vertical programs focusing on family planning, and again, we see an emphasis on long-lasting contraceptive. This is good. We don't want to lose those funding, but we need to go back to the comprehensive funding of sexual and reproductive health as an integrated package, because we know that there are links between sexuality and papillomavirus and then etc., cancer. So we know there are these links about different components of sexual and reproductive health, and we cannot lose that. And the second point, of course, the funding is mostly for technocratic, technical approach, access to services. This is again very important, but because of what I have said before, we cannot attain sexual and reproductive health unless we also pay attention to empowering women, to social condition, to cultural barrier, etc., etc. And that requires an activist approach, which unfortunately very little donors these days are putting direct funding to local organizations. A lot is going through intermediaries and often not even international NGO, but contractors. So again, what can we do about it? We need to shift. We need to shift from our focus, which pay a lot of attention to international aid. Now our public scrutiny should go towards private sources, whether foundation or corporate donor, because that is the trend in funding of sexual reproductive health. We need to monitor how these streams, which are not as visible, because governments at least are accountable to the citizen of their country, so a lot of information is public. This is not the same for private sources. Lobby for transparency of these private sources and expose conflict of interest when we talk about public-private partnership, corporate social responsibility. Let's look very closely who is sponsoring and why it is sponsoring. With all this, what I am proposing is a more structural approach to bring justice and fairness to the core of sexual and reproductive health and beyond. To do this, we need to address the driver of disparity. We need to address the causes of social exclusion, promote diversity in a comprehensive way, question patriarchy, put back feminism, and of course question all other power relations, which I have no time to discuss today, emphasize human rights and civil society, reform and democratize funding practices. We have a right to know about that. Only then the rhetoric of SDGs aspiration will be realized. Society hopefully will be transformed in such a way that indeed no one is left behind. Thank you very much.